I was fortunate enough to get Dr. Joy Nicewander and Dr. Michelle Zweibach to come to the podcast studio so that I could ask them all of the questions that I hear parents ask. I've broken it into 3 parts. Hi, I'm Faye Bankler Casell. I am a certified academic language therapist and your home reading coach. This is part 1 of 3 parts of a conversation. Here we go. Thank you both for coming. Our channel really addresses parents who want to get their kids reading and specifically have struggling readers or children with dyslexia. And a lot of the questions that they ask are about getting their child diagnosed, getting them services. And so today I thought that I can ask you some frequently asked questions. But before we get there, can you introduce yourself?
Sure. I can go first. I'm Joy Nicewander. I am a licensed psychologist and a licensed school psychologist. I've been in practice 20 years almost. And initially I worked in public schools. So I worked in Dallas ISD. I worked for a contract company here in San Antonio for many years. And I've been in private practice for about 3 years. So most of my work is psychoeducational evaluations with children and young adults for a variety of neurodevelopmental disorders, including learning disabilities.
Great. What about you, Michelle?
Yes. Also a licensed psychologist and a school psychologist. And I guess I didn't say my name is Michelle Zweibach. I've been working for about 14 years. And first I was a school psychologist working in the public school setting. And I have also worked as a licensed psych associate, but later I got my PhD, and so now I'm a licensed psychologist. I have 2 jobs right now. I work at Stonebridge Behavioral Health, which is a group practice where we do psychological evaluations. And I also have a private practice called Brainstorm Psychological Services, where I work with families doing psychoeducational evaluations, psychological evaluations, basically everything Joy does, I also do.
Great. So let's talk a little bit about the licensed school psychology, licensed psychologist. What's the difference between a diagnostician and LSSP? Can you talk a little bit about what the distinction is?
Absolutely. A licensed specialist in school psychology. It used to be LSSP. Now it's changed to a licensed school psychologist. They typically have master's degrees and they can work in public school settings and private school settings, charter schools, and they complete evaluations that are FIEs, so full and individual evaluations. So licensed psychologist, it's additional licensing that you get after you complete a doctoral program in psychology.
Mm-hmm.
So you have to have a PhD, and then it's an additional test you have to pass to become a licensed psychologist. And that's when you can have a private practice as a psychologist.
I can also add to that, a school psychologist can only diagnose educational eligibilities, like the TEA eligibility criteria. So they could diagnose an emotional disability, but they cannot diagnose like private DSM-5 diagnoses. So they couldn't say like major depressive disorder, generalized anxiety disorder. Only a licensed psychologist or a licensed psych associate could do that. Somebody who's licensed outside of the schools as well. And so Joy and I have both licenses, whereas just a school psychologist could only do the one thing in the schools. And some licensed psychologists aren't also school psychologists. So it's unique, actually, that we can do both. And then educational diagnosticians, that's a whole other field. It's more educational, less psychological. And those professionals usually have a master's degree.
Usually they have teaching experience, I believe,
Yes.
and a master's degree, but they diagnose more learning disabilities. So more kind of academic issues is what diagnosticians diagnose.
And so when a parent goes to a public school to get a diagnosis, it would generally be through a diagnostician and then or an LSSP. Yeah. And I believe, for example, at school, something like ADHD would not be diagnosable at school.
ADHD could be diagnosed by a medical doctor or a psychologist, but not a school psychologist. If a kid already has a diagnosis of ADHD, then the school can do testing to support that and say, here's how it impacts them at school. But they cannot actually give the diagnosis.
There are so many co-occurring diagnoses like ADHD, dysgraphia, dyscalculia, I never know how to pronounce that, expressive receptive language disorders. So can you talk about diagnoses that maybe are co-occurring, that happen a lot, that a parent's going to want to get evaluated for outside of a school?
I think ADHD is a big one because school psychologists can do a lot of good observations of students in school. They can almost get to the point of saying there's a lot of data to support attention challenges, but since they can't make that diagnosis, that's where we come in because we can actually make that diagnosis. So ADHD is a big one.
And certain resources for autism aren't available just with the school diagnosis, I have learned. So many, like ABA therapy, I don't think they will accept a full and individual evaluation that says autism. It has to be done by a licensed psychologist.
Thank you. That was helpful. Mm-hmm. So let's talk specifically about a dyslexia diagnosis. Sometimes at a public school, they're reluctant to diagnose dyslexia. They might word it as specific language disorder. Can you talk about why parents would come to you privately and the kind of testing you do, what happens during that process, or what concerns should definitely bring a parent to asking for testing?
I can speak on that probably. Having been a school psychologist in the public schools for a long time, when I first started in like 2012, we didn't diagnose dyslexia, or at least that's not how I was taught. It was specific learning disability in reading, like basic reading or reading fluency. Maybe we were even told not to use the word dyslexia. It was a big mystery. Yeah. And several years ago, it was suddenly like, no, y'all need to start using that word. Right. And you have to know how to diagnose it. So I would say today, all school psychologists and diagnosticians should know how, and I would trust them to be able to diagnose dyslexia. Sometimes it's missed in the schools. Sometimes the school won't test for it. They might say, no, your child is not failing anything, or they've passed their STAR test, so we're not going to test at all. And then that's why a parent might come to us.
Sometimes I see too that parents will see the risk factors pretty early on, like articulation disorder, family history of dyslexia, some of those early phonological issues, but the school might say, we don't generally recommend testing for that until second grade or something like that. Whereas we now know the research supports earlier diagnosis. I think this is why it's good to use multiple data points, right? Like we don't want to rely, even for eye testing, we don't rely on one test or one score. We use a lot of information to make those determinations. So I think in determining if they're at risk for dyslexia, we have to do the same, look at lots of data points.
And some teachers don't necessarily know what the risk factors are for dyslexia, or they don't know what it looks like. So I know both of us will send out like a risk factor checklist. Yeah.
So tell me about the tests that you do utilize for learning disabilities, and specifically dyslexia, or the kinds of activities and things that parents would expect to see their children doing with you.
Yeah, go ahead.
So usually, I think Michelle and I are pretty similar in this. We give a whole battery of assessments. For younger kids, that can look like half a day in the office. For older kids, it can be more of a full day. Looking at their cognitive ability. So we want to see not just what's your IQ, but what's the pattern within the profile. So verbal ability, nonverbal abstract thinking, memory, processing speed. And then we look at phonological processing. So that's a big part of the evaluation. We know that if you have a hard time processing oral language, that there's a high correlation with oral language processing and reading challenges. So usually I tell parents, this is things like, say cowboy, now say cowboy without saying cow. Can you break words apart? Can you blend words together? Can you isolate sounds within words? If your child's struggling with that, even before they get to school, that can be an indicator that they're going to struggle with some reading challenges. And then we do a whole battery of academic testing, starting very foundational, looking at letter identification. Can they identify letter sounds? Can they decode unfamiliar words or nonsense words? Can they read sight words? And building from there to the fluency and the comprehension pieces. We also look at math and writing and spelling, the whole picture. And I like to tell families our job is to identify or rule out anything that's going on that could be interfering with their learning, not just academics, but usually we like to screen for emotional behavioral concerns as well. So.
Yeah. Exactly the same.
All of those things. So can you talk to me about, because sometimes families will start with a private, if they're a public school family, let's say, or a private school family, they start with a private evaluation from a licensed psychologist, and then maybe they decide to go into a public school and they bring that evaluation report and often can get pushback. Do you have any insight into that you could share?
Yes, I think it depends on the school district, also who the private evaluator is. Like we talked about how we're both school psychologist and licensed psychologist. So we have, and based on our experience, we know what the school is looking for, what tests they would give. So we try to match it as close as possible. And sometimes ours are more comprehensive. We're not as stretched for time as the public school workers. But we have found that sometimes they're like, great, this is a beautiful report. Let's start the dyslexia services. That's like best case scenario.
I mean, that's what you're
ideal.
hoping
Yes.
for.
Yes. But sometimes they'll say, oh, this is great. We feel like we want to do our own evaluation. And so they'll put the child through a whole other evaluation, which is almost exactly the same, maybe different test, but same thing, which that's probably worst case scenario. Or worst case scenario could be no. Just no.
I'll give you an example of some worst case scenario, including with dyslexia. The outside evaluation is a medical diagnosis and doesn't necessarily dictate educational impact. I feel like what you're describing is different because you are so thoroughly looking at educational impact.
That's why it's important to know what private evaluator you're going to, because you could go to just some like random person who says they're a dyslexia evaluator and maybe they don't have the right credentials that the school would accept, or maybe they don't even know what they're doing. So it's important to ask questions like, how are you licensed? What is your experience? Those kinds of things.
And usually, I think Michelle and I both do this. We try to say in our report, within a public school setting, this child should be considered for special education services as a child with a specific learning disability. Or if we feel like there's not that educational need, because we are talking to teachers and parents, sometimes I'll say they meet DSM criteria. Sometimes this happens with children who have maybe a really high IQ and their reading is average. So they're probably not going to qualify for school-based services because they don't show that educational need, but they could benefit from services like yours. So like private dyslexia services, or in the case of ADHD, do they need 504 accommodations or do they need special education? So we try to tailor our reports to take back to the public schools. Like this is what we would recommend as school psychologists.
Yeah. Another thing that is important is to include school input in the evaluation. Like she mentioned, we talk to teachers. We always try to interview them or have them fill out risk factor rating scales, things like that. Sometimes we'll observe a student in the classroom. That way it's very clear this is the educational impact. So they can't say, oh, it's medical diagnosis.
Okay.
Not everybody does that, but that would help, definitely, including the school input. And I'll always ask for like report cards or like MAP score reports,
star reports,
so that we can say this is exactly what you would have included in your report.
Perfect. Okay, that's wonderful to hear. So when they are asking questions of an outside private evaluator, they want to ask about credentials, and they specifically are looking for licensed psychologists or licensed school psychologists?
Ideally both.
Okay. If they meet a private diagnostician, could it go either way, or because they do the school evaluations? What are your...
I mean, I think because we, like the school psychologists, have the ability to do the things that a diagnostician does in terms of academic testing. So I'm clearly biased, but I think you should come to us if you want that testing. Yeah.
Yeah.